All right, so how do I navigate exercise in the gym? What's okay to push? What's not okay to push? Which deadlift variations are okay? Are certain weights okay? Certain rep ranges okay? Right. And the way I try to figure out what's okay and what's not is by using something called the pain monitoring model. Okay. I've been talking about this for years without giving any credit to the person who kind of figured this out first. So I guess the gentleman who figured this out first was Tommy, and I'm hoping this is a man because I just said it was a man. It might be a woman. I apologize. But this was in the Journal of Physical Therapy in 1997, a comprehensive treatment approach for patellofemoral pain syndrome in young women. This pain monitoring model has been used for all sorts of pathologies. So patellofemoral pain here, but also with a lot of tendinopathy pain. So probably most popular is going to be either in the Achilles or the patellar pain or patellar tendon. So essentially, what this pain monitoring model is they'll take two groups of people. One group is not allowed to work through pain. The other group is allowed to work through pain as long as their pain is less than about a 5 out of 10. And the other caveat is that your pain has to go back to baseline the following day. So in, let's say, patellar tendinopathy, they'll do like a single-legged squat and they'll figure out what the patient's pain is. Let's say the pain is like about a 3 out of 10, right? And then they'll run them through a whole bunch of exercises. Let's say running, jumping, changing direction. Make sure that pain is below a 5 out of 10. And the next day, if your pain on that single-legged squat is still about a 3 out of 10, right? You didn't flare things up more, then an exercise is okay to continue pushing. When you compare those folks who are pushing into some pain, but the next day the pain kind of goes back to the baseline versus folks that aren't allowed to push through pain, the same outcome, right? So it's absolute no-brainer to have your patients continue training as much as possible, as long as they respect this injury and don't push too much, because generally speaking, the research shows that you can. So you can kind of gain some fitness benefit, some strength benefit, and push this injury, right? And not flare things up and have the same rate of progress. There's also a little bit of research to show that if you push into some pain, right? So if you kind of ask your patients to push into a little bit of pain, they'll have a better short-term outcome. And that's awesome, right? And that really does reframe pain in your patient's mind, because if they're starting to feel a little bit of that pain, I'll say, good, all right, we're putting the medicine where it needs to be. So if someone is deadlifting, like, yeah, it feels a little bit sore, we're like, all right, great, because the stress is going in the right spot, okay? Now, all of a sudden, it flips the patient's thinking from, oh, crap, I can't and shouldn't exercise because the exercise is causing damage, to, oh, good, I'm putting the exercise and medicine in the right area. So over the course of time, I'm going to progress, right? And that's actually very, very powerful, especially folks that are pretty fear avoidant. Because what happens in those folks is that every time they exercise, they feel pain. They're like, oh, crap, I'm not healed yet. I need to avoid all exercise until I start feeling better. And that's obviously not what we want. So flip that way of thinking in your patients. It's a game changer for sure. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.